los adultos que vengan.
De Granada podemos decir que es la ciudad más antigua del continente centroamericano. Granada es muy rica en su cultura, arquitectura, su gente muy linda, pero además necesita mucha, pero mucha cultura. Mi nombre es Edis Sandino Cruz, directora fundadora del Colegio San Antonio. Esta es una bendición de Dios para los niños del colegio y los ciudadanos de Granada. Nosotros somos carentes en su mayoría. Es por eso que hemos encontrado cantidades de niños con caries y a temprana edad extracciones de muelas, ¿verdad? Debido a la falta de higiene bucal. Pero hoy con este proyecto nosotros pensamos que vamos a ser un ejemplo para el resto de escuelas, niños y niñas de la temprana edad.
Usually in locations such as Granada, Nicaragua, we know that there is a dearth of dental providers in the area. With that is a great need for children specifically, but also lots of emergency needs for adults.
There's three things that we do on outreaches. One is service. We do treat a lot of patients, up to 1,000 in a week. The second is teaching, and it is a very, very hands-on activity. We work intimately with the students, one-on-one with patients. Their abilities and their skill sets just make a major, major jump. And the third piece is to do research on all of these things, hopefully finding some type of a model that we can move to other places.
The outreach begins usually about a year in advance when a local partner, in this case it was Melanie and Guillermo, come into our offices in New York and say that they have an interest in starting an outreach in a particular area, and for them their area of interest was Granada, Nicaragua.
When we met with the NYU team and they expressed an interest in doing an outreach in Granada, Melanie Hughes, my better half, and I, we jumped on it because we have some ties with the community. We did everything that we absolutely could to facilitate them coming here and setting up their clinic.
The primary focus of any NYUCD outreach is the children in that local community, and for us that includes going into a school, this one being Colegio San Antonio, and finding a group of children and bring them into our clinic and complete all of their treatment needs. We have a grant from Henry Schein Cares which allows us to bring all of our supplies and materials.
En cámara. Hola, ¿qué tal, hombre?
Mi nombre es María Elena Quintanilla, soy docente de la escuela Pablo Antonio Cuadra.
Es la primera vez que van al dentista, que van a una clínica, que visitan una clínica. Es la primera vez, dado la economía en sus hogares. Y programas de esta categoría no hay.
Brigadas así, especialmente para que atiendan el centro, es la primera vez que vienen. Agradecemos por este gran apoyo que nos brindan y sobre todo a los cooperantes que vienen a hacer el trabajo de odontología con nuestros niños. ¡Maravilloso
Me llamo Gloria Mayorga. Me han atendido a mis nietos, me lo han atendido muy bien. Le pusieron algo allí en una muela que le brilla, pues. Y me siento muy contenta, porque son cosas que económicamente yo no puedo hacer, ¿ves? Y estoy bien emocionada, pues, y ahí sí estoy emocionadísima. Y le doy gracias a todos ustedes, pues, que hacen cosas buenas,
Before coming on this trip, I kind of expected it to be just a faster paced clinic, but the same procedure and the same motions as what happens in clinic.
They are like actually helping us make our own decisions, and in that sense it's been like wonderful. We are able to work more on ourselves with the supervision that we need. Like there's always a faculty there, but it's more like you feel you are doing the job. So that's really good.
I've gained a lot of clinical skills, I've gained a lot of speed and a certain expertise that I didn't have.
Dr. Hirsch, he told me, do not be afraid, just go. Do not be afraid, be confident, you're a doctor and you can do that.
People will go without getting up from a chair because we all want to sort of be able to see every child that comes to the clinic and provide exceptional service.
On the kids side, we've seen about 314 kids. We charted the condition of the mouth and treatment plan as necessary. We completed treatment on 90% of the kids that we saw. So the prevalence rate that we have is sitting at about 65%. 65% out of 314 kids have dental decay. Over on the adult side, we estimate there's been 1,000 visits for the patients that have received emergency care.
And in order for us to create a program that's sustainable, we work with the teachers in the school and teach them how to apply fluoride varnish on the children themselves. So it's a single unit dose application. It doesn't require wearing gloves in order to apply it. It's very simple. It takes about 15 seconds a child. So we come here in September and we complete all of the clinical treatment needs for each child in this school. And then every 3 months going forward until we return next year, the teachers will be applying the fluoride varnish on the children in their class. And that's really establishing a preventive routine for these kids. So hopefully when we return next year, we'll see a lot less treatment needs and the children will be in the habit of brushing their teeth and will be used to receiving fluoride varnish.
Just watching them, watching how much pain they've relieved, how many people's lives they've improved, just makes me more committed to helping them in the future and for next year and the year after and for as long as they want to continue doing this in Granada.